For the most part, I've always been a healthy individual. Right now I live in the Florida Keys. I live in Tavernier, mile marker 91 and a half. I've always been called by the water, by the ocean, by this kind of lifestyle. I try to eat and do the healthy things. I do not drink. I never smoked. My sister started getting these, I guess it's a heart murmur, but she started finding out that she had Afib. And she was wearing an Apple Watch, which is very good to give you warnings, I guess. So she said, you should wear your Apple Watch. And I started listening to her. And slowly I started to realize that I was getting episodes of Afib. I would feel a little bit tired, a little bit short of breath. What do I think? I'm getting older. I overdo things. That wasn't the case. Eventually I was constantly in Afib. You know, I have a cardiologist down here, very good, and they recommended that I go to see Dr. Wilner.
So I met Juan in my clinic several months ago. He had been diagnosed with atrial fibrillation. And ultimately, we decided to perform what's called an atrial fibrillation ablation.
Dr. Wilner was excellent, a true professional, answered all my questions and questions that I didn't even know I had. The experience was great as they were getting me ready for the surgery. I'm a little bit of a wise guy sometimes. I'm always joking, and the staff was joking with me, made me feel at home, made me feel very, very comfortable, but I knew I was in good hands, and that's all that counted for me.
An ablation is about a 2-hour procedure. It's an outpatient procedure. The patient comes in the morning, the procedure is performed, they're in recovery for about 4 hours, and they go home later that day, which is exactly what happened with Juan, and he was back to living his normal life the next day. What we do during an atrial fibrillation ablation is we put catheters through the veins in the groin up into the heart. We go to the left side of the heart where atrial fibrillation comes from, and we ablate those areas. And ultimately what that does is prevent progression of atrial fibrillation, and it also can decrease the risk of stroke.
They did the procedure, and when I came out of the anesthesia, I felt great. I felt a very high level of energy that I hadn't experienced in like a couple of years. And I said, well, what did they do?
Taking care of Juan truly was an honor, and there's nothing more rewarding as a physician and as a proceduralist to know that a patient is doing excellent after a procedure and knowing that you've really changed their quality of life. If you have atrial fibrillation, I truly believe you should be treated at Baptist Health Miami Cardiac and Vascular Institute. We offer cutting-edge technology and provide world-class care so that patients ultimately have the best outcome.
When something works, and I believe in it, I stick with it. As far as like treatment and care and the trustworthiness, this is the only place I would ever go.